This is a new talk, and I assure you that you will learn something very new. What I am going to demonstrate today with a prelude and scientific explanation is about the role of hydrozone in osteoarthritis of the knee joint. The question that will spring to your mind suddenly is, what is this hydrozone? Irrespective of the radiological appearance of the arthritic knee, the patient approaches the treating surgeon with one single principal complaint, and that is pain. The patient is not bothered about the radiology. The patient is not bothered about the varus or valgus. The patient is primarily complaining about pain in the joint. Excessive production of reactive oxygen species amplifies pro-inflammatory pathways and exacerbates the immune response. And that is a key factor in the progression of osteoarthritis of the knee. Therapeutic molecular hydrogen with powerful antioxidative, anti-inflammatory effects has a great potential for OA relief, OA pain relief. This is being studied. Lot of papers are being published, and this is going to be the new emerging molecule. You can see from the above chart that how a hydrogen injection will work on the scavenger ROS and produce anti-inflammatory reaction. This is not my drawing. I've taken it from one of the published papers in one of the international journals. The commonly used anti-inflammatory, analgesic, and joint improving therapies and drugs in clinical practice can only relieve the OA related pain but do not modify the articular pathology. I have known patients who have gone to renal failure by long-term use of diclofenac sodium or aclofenac sodium, which I have stopped prescribing altogether. All the painkiller medicines have got serious side effects, and one must be very careful to ensure that we use minimal or no painkillers. In younger obese patients with grade 3 or 4 osteoarthritis, knee replacement is not an ideal solution, as 40% patients will need one or more revisions in their lifetime, or may suffer from early or late delayed complications, multiple surgeries, revisions, periprosthetic fractures, which is a complete saga of nightmares. And if the patient is shown the possible complications that can occur, he would probably agree to live with the pain than get his knee replaced at the age of 40. Therefore, it is important to study new strategies for prevention and treatment of OA. And Hydrozone is a new modality which I invented in November 2023 and have been using it for the last 6 months with what I personally perceive as spectacular results. Overproduction of the ROS plays a critical role in the occurrence and progression of the osteoarthritis of the knee and activates the NF-kappa B signaling pathway associated with inflammation, immune responses, inducing cellular oxidative damage and apoptosis. In addition, This also impairs the chondrocyte function and leads to mitochondrial DNA damage, increased production of pro-inflammatory cytokines and metalloproteinases, resulting in enhanced inflammatory responses and altered articular cartilage morphology and histology. Like molecular hydrogen, ozone is also a miracle molecule useful in large number of conditions. Several studies and many years of clinical experience state that ozone has proven effect on modulation of inflammation and in the release of stem cells and growth factors, promoting cartilage growth and repair mechanisms. A recent review states that O3 can act on the pathogenesis of OA by reducing inflammatory cytokines. Interleukin 1b, TNF alpha, TNF gamma, C-reactive, protein, ESR, uric acid. It also reduces the catabolic chemokines and stimulates the anti-inflammatory cytokines like interleukin 4, interleukin 10, interleukin 13, and also stimulates anabolic chemokines TGF beta and TGF 1. So, ozone in itself is a wonderful molecule for osteoarthritis of the knee. It has also been observed that O3 is capable of inhibiting prostaglandins, bradykinin, and as a result, reduction of pain and edema is achieved. Ozone is able to stimulate chondrocytes and fibroblast proliferation and encourage synthesis of articular cartilage repair and tissue defects with wonderful results. In recent years, molecular hydrogen of H2 is demonstrated as a therapeutic medical gas which is a safe antioxidant and its only byproduct is water. Though hydrogen is the most abundant element in the universe, in its natural form, hydrogen is non-existent on this earth. However, 66% of Earth's surface is covered with water and that contains hydrogen. Many studies have shown that hydrogen molecule or molecular hydrogen has excellent effects as an antioxidative, stress buster, anti-inflammatory, anti-apoptosis, and as it selectively consumes the hydroxyl radical, which is the most cytotoxic of ROS, it does not disturb other ROS with physiological roles. So it's selectively active on harmful ROS. Ozone and hydrogen work on complementary pathways. And a lot of experiments were done to ensure that a combination of ozone and hydrogen do not neutralize each other. And we have eventually found out that a combination of both in grade 3 and 4 OA knees produces wonderful results. The formula is simple: Chennai cocktail 6 ml, ozone 6 ml, and molecular 6 ml through the same prick, one needle. 18 ml seems like a large volume, but because 12 ml is gaseous, the gases get absorbed quite soon and there is no visible swelling or apparent effusion of the knee at the end of 20 minutes, where the patient is absolutely pain-free and happy. This procedure has been named as the Prakash Hydrozone therapy because this is invented by me and is being described here for the very first time in the literature. A scientific publication about the same is being written up and shall be published shortly when we have sufficient follow-up with numbers. From November 2023, to March 2024, that is only 6 months, we have treated 18 cases of grade 3 or 4 OA by Hydrozone. These patients were all advised total knee replacements and were either unwilling for surgery or, in my consideration, their age was considerably less to need knee replacement at that stage. So far, all patients are managing comfortably despite having been advised TKR by many surgeons, and none of them have needed a repeat injection in 6 months. All patients are in contact with me in WhatsApp, and I am regularly following them and have not lost a single patient to follow up. Despite obvious deformities and gross arthritis of the knee, these patients seem to be managing very well with a single injection for 6 months at least. The knees varied from as good as this to as bad as this, and the next two videos will show how hydrozone injection is used in a patient with grade 3 or grade 4 osteoarthritis of the knee. Before that, there will be a short video of an experiment to see if molecular ozone and molecular hydrogen react with each other or neutralize each other. I withdrew 10 ml of 70 microgram ozone in one syringe, and into this added 20 ml of 99.99 purity hydrogen, and the syringe was locked. We waited for 1 hour. This was to assess whether hydrogen and ozone react with each other chemically or neutralize each other. We found no physical or chemical change in the constituents. Hydrogen is odorless, colorless, so cannot be smelt. Nevertheless, we could smell the ozone when the lid was opened. As per the chemistry books, inert molecular hydrogen and ozone have no reaction and will remain in a mixed state with each other, with each gas performing its own action. It is very important to remember that the hydrogen is taken from the machine just before injecting because it is lighter than air. Ozone, being heavier than air, can be withdrawn and held vertically so that it doesn't mix with the air. We first mix the cocktail, then we give the ozone, and then we give the hydrogen. Then the complete sequence of the procedure and also the experiment done for the same are being demonstrated in the videos subsequently. I got an idea of combining intraarticular Chennai cocktail, hydrogen and ozone to evaluate the efficiency in grade 3 or 4 osteoarthritis of the knee. In knee OA, especially grade 3 and 4, hydrozone delays TKR by 6 months plus. Studies continue, and hydrozone seems to be much more effective than ozone alone and even produces radiological changes in a percentage of patients, not all patients. You can see one of the patients with an almost deranged knee showing reappearance of medial joint space within 3 months of hydrozone injection alone, and both X-rays are weight-bearing views. The Chennai cocktail that is being used as a prelude to hydrozone injections consists of 2% xylocaine 2 milliliters, Kinacort 0.5 ml, clonidine 30 micrograms, and water for injection 4 milliliters. The video shows 2 cases of hydrozone injections, and patients get immediate relief and long-term so far. The knee is cleaned with betadine. This lady has bilateral osteoarthritis of her knee, and here we are going to give her a hydrozone injection with Chennai cocktail. The first step is to prepare 10 ml of cocktail, which will be given 5 ml in each knee, 2 ml of xylocaine, 0.5 ml of Kinacort, and 30 micrograms of clonidine are drawn into a 10 ml syringe, and then 8 ml of distilled water or water for injection is drawn into the syringe to make a quantity of about 18 ml. We also take 10 ml of 70 microgram percent ozone and 5 to 10 ml of 99.99% purity hydrogen. Connect them with a closed bivalve. The knee is entered. 5 to 6 ml of cocktail is injected into the knee, and then we attach the combination syringe to the needle. The bivalve is open to first allow injection of ozone and then turn to allow injection of hydrogen, and the needle is removed in one shot. The patient is asked to flex and extend her knee repeatedly till the cocktail and the gases diffuse into the knee joint. The same procedure is being repeated for the other knee. Again, we are drawing 15 to 20 ml of ozone in a syringe, attach it to a three-way, and then add 10 ml of hydrogen. Lock the three-way so that the gases don't escape. Inject the opposite knee. As I am injecting from one side, I have used the lateral portal for the right knee and the medial portal for the left knee. The needle is not removed. The same procedure is repeated for both left and right knees. Once injected, the bivalve is shifted and we inject both gases into the knee. The patient is encouraged to move both the knees, flex and extend to ensure that the combination of cocktail, ozone and hydrogen is dissipated thoroughly into the knee joints. The pain relief comes after about 10 minutes. The movements will also improve dramatically, and this combination gives good pain relief. The duration of pain relief depending upon the grade of osteoarthritis of knee. Again, for the next patient, we are mixing the same cocktail with xylocaine, clonidine, small amount of Vicot or depameterol, and then we make the hydrozone syringe complex, which is attaching a three-way and taking ozone and hydrogen in two syringes, attaching them to a closed bivalve or a three-way, and then injecting them one after the other in the knee joint. You can see that one syringe contains ozone, one syringe contains hydrogen. The joint is penetrated with the needle. The cocktail is injected, and then the combination is injected. First, the bivalve is opened to inject the ozone, and then the hydrogen. The patient is encouraged to move the knees and experiences good pain relief immediately. If you are interested in the course, you can message to the number given subsequently. Thank you.